Why the ganglion cysts in your wrist need immediate attention. We may not notice ganglion cysts in the wrist. In fact, as long as it is painless growth, we may never seek medical care for it. A condition in the wrist happens due to tension in the arm, a tumor, or even a fall. While most strokes are modest and disappear on their own over time, others hurt or grow rapidly, at which point medical intervention is needed. Do you remember that abnormal ball that appeared once on your wrist or on the back of your palm? Bulges are cysts that form on the back of the hand because of the subtle abnormalities in the outer tendon sheath. These abnormalities cause an overproduction of a fluid in the subcutaneous tissue. The fluid, which is rich in protein content, irritates the skin, thus forming a cyst. A cyst on the wrist may be of different varieties, the most common of which is called the ganglion cyst. What is a ganglion cyst? A ganglion cyst rises and grows outside the tissues surrounding a joint, such as ligaments, tendon sheaths and their linings. Inside the cyst, in the shape of a balloon, is a thick, slippery fluid. These cysts can appear and disappear quite quickly. They develop into several joints of the hand and wrist, including the top and bottom, as well as the final joint or the base of a finger. In most cases, they are not cancerous and harmless. Why do ganglion cysts occur? Between 15 and 40 years, these cysts usually appear, just as in gymnasts. While no cause has been established, we can assume that it is during this period that we spend most of our time driving, or with our computers, which may exacerbate the problem. Symptoms of ganglion cysts on the wrists. Although no other symptoms are observed, sometimes, if the cyst puts pressure on the nerves that pass through that joint, they cause some discomfort with pain, tingling and muscle weakness. Should you worry? Ganglion cysts are fairly common and harmless. However, there may be some discomfort associated with them. For example, putting pressure on an adjacent joint, causing pain and tingling, followed by weakening of the muscle. If the cyst is large, its appearance could be cause for concern. X-rays help evaluate bones, joints, and soft tissues. Additional analyses such as ultrasound, computed tomography, MRI, or even bone scans are added to reduce the diagnosis. Sometimes, if a surgeon suspects a tumor, you may want to opt for the biopsy in order to confirm the diagnosis before proceeding for a treatment. How are cysts treated? There are a number of ways to treat a ganglion, but leaving it alone is the best option in most cases. Since a ganglion is not cancerous, waiting for it to go away does not cause any harm. Your doctor may ask you to keep watching and note any changes in it. However, sometimes a ganglion causes severe pain and discomfort. In such cases, a wristband or splint is your best choice to relieve the area. Once the pain is slightly more manageable, your doctor may suggest exercises to strengthen the wrist and regain range of motion.